Hello, I'm Dr. Radia Kurfi. I work here at Wolverhampton Road Surgery. I'm a GP and a partner here in Stafford. I would like to introduce you to some great team members we've got in here, so come with me. Traditionally, you would see a GP like me for a full range of conditions, but now we have quite a range of healthcare professionals who are experts in their fields, and they will see our patients here at the surgery or support our patients in the community. Let's meet them. Karen is our most experienced advanced nurse practitioner, so she's qualified as a nurse for over 10 years and then has been an advanced nurse practitioner for another 10 years. She works here with us and she can also prescribe like a GP would.
My name is Karen Orcock. I'm the lead nurse, advanced nurse practitioner here at Wolverhampton Road Surgery. I started in accident and emergency here in Stafford. Then went on to the community, worked in minor injuries for several years in Cannock as a nurse-led nursing team. From there I did my degree and in emergency care, my prescribing. So I started my master's advanced clinical practice to become an advanced nurse practitioner, and I've been doing that now for over 10 years. I work with the urgent care team here in Wolverhampton Road Surgery. I clinically assess patients and I can prescribe also. So I can see acute and chronic conditions. I see patients with mental health problems, contraception, HRT.
So most people think physiotherapists are based in hospitals, maybe helping patients recover after an operation or an injury. But generally now we have more and more physiotherapists working in GP practices. Here we've got Rob, who is our first contact physio. He is a specialist in a range of musculoskeletal conditions and he sees our patients or speaks to them here.
My name is Rob Timmerman. I'm a first contact physiotherapist employed by the Primary Care Network. We, as a first contact physio team, deal with patients who call the surgery with pains in joints or muscles, tendons, occasionally nerve pains. We can give advice with regards ongoing management, exercise therapy. I can see patients referred straight, or people who ring the surgery can be referred straight to me. The service can also give you, injections if you need to, or give you information with regards painkillers, medication. Personally, I'm a physiotherapy prescriber, so I would be able to prescribe your medication if you need to. We can also refer you on for other services and or x-rays or imaging if the need is there following our assessment.
So here at Wolverhampton Road Surgery we have got a team of clinical pharmacists. One of them is Harris. He's an expert in his own field. I find it quite useful actually asking Harris or any of his colleagues about patients when I'm doing medication reviews. So patients can book in directly with our clinical pharmacist for medication queries and reviews.
So my name's Harris and I'm a clinical pharmacist and I work across 4 different GP surgeries within our primary care network. In order to become a clinical pharmacist, I've actually had to train for 7 years in total, which is actually similarly to what a GP needs to train for anyway. As a clinical pharmacist, based in a GP surgery, we are the specialists for the GP surgery on medication issues and medication interactions and side effects. So another important role of our jobs is our medication reviews. Typically during a medication review we will sit down with the patient, we'll have a quick chat about each individual medication, explain to the patient why they're on this and why it's important to take it, explain to them when best to take it and how often to take it as well, and also any potential problems that can arise. We can help the patient by adding medication to their medication plan, removing medication if we're feeling like the medication is not doing as it should do, or adjust doses. And we can see that whole process through because majority of clinical pharmacists now are prescribers.
not everything would need a prescription or involvement of a GP, as we've discussed earlier. So here at the surgery, we've got a community link advisor. You might know them as a social prescriber.
My name's Sharon and I'm the Senior Community Link Advisor for the Social Prescribing Service. Social prescribing is an approach that is not about pills and potions, so we're here to see what we can do to help you. A practical example for social prescribing could be you're living in a damp flat with your little one. Little one is perhaps a little asthmatic, or you're struggling and you're depressed because of where you're living. That's not going to necessarily be a clinical solution, but we can put you in touch with housing organisations. Another example could be somebody who's caring for someone, for example. We've had a lot of people come through recently who have found themselves with extra caring responsibilities and they don't always know where to go to get some extra help. We can put them in touch with people that are experiencing a similar situation, so it could be a support group so that they can have a couple of hours off. We can put them in touch with people to make sure they've got the right benefits. We're here for you. If it's not a clinical need, we can help you.
So we are very determined to treat mental health conditions with high importance as we do for physical health conditions. So here at the surgery we've got something called IAPT, which is psychological and talking therapies, which Steph will talk to you about.
Hi, my name's Steph Smith and I'm a Wellbeing Practitioner based at Wolverhampton Road Surgery. We specialise in low-level mental health conditions such as anxiety and low-level depression. Some people can feel very uncomfortable talking about their mental health, but it can be amazing to see how some simple therapies can really help them. We'll speak to you in a place where you feel comfortable and talk to you about how we can help support you and make your life a little bit better. Very often people can start to feel better and make changes in themselves. They make adjustments and are able to better handle things that make them anxious and feel low.
So here at the surgery we have got care navigators. So for our patients, that would be the first person that you might speak to when you call the surgery. They may ask you some questions, and the reason why they do that is so that they can put you to the right or health professional. So they would be able to put you through to a GP appointment, or maybe Rob, like the physiotherapist, or even the pharmacist. I'd like to introduce you to Alex.
So my name's Alex and I'm one of the care navigators here at the Wolverhampton Road GP Surgery. So I'm the lady that will pick up the phone. I will ask you a few questions just so I can make sure that I pop you through to the right member of the team. We're specially trained, so everything that you tell us will remain absolutely confidential.
So here at Wolverhampton Road Surgery we've got a team of specialists. They might all be based within one practice, or they could be shared between a group of practices, what we call a primary care network. But they're all specialists. They've got the right training and the right expertise to help you